In this video, I want to talk about the arteries and veins of the thorax, and I'm going to start with the arteries. Now, we're going to start by looking at the aorta. The aorta starts with a portion that's going upward. This guy right here is known as the ascending limb. Then, when it starts to go downward, it becomes the descending limb. Once it's in the thorax, it's called the thoracic limb. And then below the diaphragm, which would be down below here, there we go. Then it's the abdominal aorta. So first what I want to do is talk about the arteries that give blood to the muscles of the thorax. Now these arteries are sort of on the outside where you'd expect them to be. They're near those muscles because that's what they serve. So the first set of these that I want to talk about are these guys here. These are called the intercostal arteries. And these intercostal arteries, you'll notice that the lower intercostals come off of the thoracic aorta. The upper intercostal arteries actually come off of that, the subclavian, or the axillary branch of the subclavian. We don't need to get that fancy, but they come off of the subclavian. And what these guys are going to do is they're going to serve that those muscles that are involved in breathing in and breathing out. So those muscles that are between your ribs that are lifting those ribs up and out. And they're also going to serve the other muscles that are located around your chest that are involved in sort of movements of your thorax. In addition, there's this artery right here. This one runs right along the sternum, and basically it would be right along the breast. So it's known as the internal thoracic or mammary artery. I always kind of remember it as mammary artery because of its position. It's in the mammary region, and so that's an easy way to remember it to me. This does go from the subclavian to it goes from the subclavian right here. Here's the mammary to those intercostals, which connect back to the subclavian. So you've got like a little bit of a circuit going on there, or what we've talked about as an anastomosis. Now, coming off of this, before I move on, coming off of this mammary artery, we have this superior epigastric artery. Because it's called epigastric means above the stomach. This artery in particular, you can kind of see from its position, is going to serve the muscles of the superior abdomen. So basically the upper abs are going to get their blood from this artery, or these arteries. Down here at the bottom of what would be the rib cage, you have the musculophrenic artery. The musculophrenic artery is going to serve those muscles of this region of the thorax. So basically the lower thorax and abdomen. It does not serve the diaphragm, even though it's located in diaphragm and it has phrenic, which is usually associated with diaphragm in the name. That just tells us the region that it's in. When we turn this guy around, we've got one more set that we've not talked about yet, and that's these guys here. These are the subcostals, and the subcostals serve, subcostals serve the muscles that are lower than the ribs, And they also serve those muscles along that part of the vertebrae and even supply some blood to the vertebrae themselves. There are additional arteries along the back that are going to be supplying their blood to muscles along the back. Now these guys are kind of fun because basically they're named after where they are, and these may not all be on your list. An example would be this dorsal scapular. It's dorsal and it's on the scapula, so that's where it gets its name. Suprascapular. This one is on top of the scapula. That's where it gets its name. And then you've got this thoracodorsal, and it's named that because it's basically dorsal on the thorax. Again, these are very likely not on your list, but the thing I like about sort of talking about them is that it reiterates where these arteries get their name from. And if I were to ask you a question like, where is this artery likely located, you should be able to, with reasonable accuracy, tell me that. So now what I want to do is switch gears and actually look at the arteries that are serving the internal structures, or the more so internal structures of the thoracic cavity. And the good news is if you're feeling a little overwhelmed right now, there aren't that many. So don't worry, okay? If we go in here, and we have to get to these, remove a bunch of these bones. All right, so I'm going to get rid of the bones here. And you know what, just for sort of completeness, I'm going to get rid of those, the subcostals. And now I'm going to zoom in. And you'll see that you've got some arteries right here. They're coming off of the, just where the aortic arch starts to descend. And where they'd go to is if there was a lung here, the lung would be right here. And these would be the arteries that are giving the lung tissue its blood that it needs, not to oxygenate, that it's getting from the pulmonary artery, but the blood that it needs for its cells to get the necessary nutrients that they need to stay alive. So these are called the bronchial arteries. Now, if we go down a little bit further, we hit another set of arteries that are right here, and these are right where your esophagus would be. And these are called, as a result, the esophageal arteries, because they would be giving the esophagus its blood. Again, just remember that arteries are usually named by where they are or the structure they serve, or both. Now, I'd like to talk about the veins that are draining these structures. So remember that our large vessel that is going into the heart is the vena cava, and really what we're talking about here is the superior vena cava. Just like we had intercostal veins, or intercostal arteries, we have intercostal veins. And just like we had subcostal arteries, we have subcostal veins. And similarly we have mammary and epigastric. So basically everything is still here. But there are some interesting and unique differences when we look at the venous system. Whoops. The mammary artery goes into the brachiocephalic trunk, basically right where it joins, where the first intercostal is in there. The rest of the intercostals drain into the azygous system. On the right side and on the left side, and now I'm going to have to get rid of some structures. On the left side, it's going to go into either this hemizygous or accessory hemizygous structure. And all the blood is going to drain into there, and then once it gets into that azygous system and the accessory hemizygous and the hemizygous drain into the azygous, which I have somehow deleted. The accessory hemizygous and the hemizygous are going to drain into the azygous, and then that's going to drain into the superior vena cava. The bronchial artery would also connect to this. An interesting thing of visible body is actually that they don't have that, or bronchial vein, excuse me. The interesting thing of visible body is actually that they don't have the bronchial vein connecting to anything. They don't have it in their model. The bronchial vein on the right side would connect directly to this azygous on the right side, and on the left side, it would be draining into this accessory hemizygous. So just know that it's not there in your model, but it is draining. Obviously, the blood does have to go somewhere. It's not going to just sit around or diffuse out.